It's become, unfortunately, a little too political.
Provinces announcing different COVID-19 restrictions and sometimes even different regional restrictions within provinces. It can all be a bit confusing, but it's unlikely to change.
We've seen very effective measures used in lots of countries where they've managed to shut this down quite effectively and had nowhere near the infection rate or the death rate that we have had in Canada.
Countries where we've seen that, like Australia, have top-down, federally led healthcare systems. Whereas in Canada,
it would have been difficult to take a nationalistic approach, given that the federal government doesn't have a hand in those health delivery, public health issues that are being managed and delivered locally.
As a result, not only do we see provinces like BC do something different from Alberta and Manitoba, some provinces like Ontario and Quebec have their own regional lockdowns, which can cause even more confusion, but do have some advantages.
If you have a large province like Ontario and you have a large segment of the province where there's no cases of COVID or very limited cases, there's an argument to be made that maybe lockdowns aren't necessary in those regions.
However, that falls flat if there's no control on travel, something East Coasters are very aware of, an area of Canada which saw a more homogenous approach, the Atlantic bubble.
The difference in Atlantic Canada is that it's a lot easier to sort of shut down borders than it is in other parts of Canada. And I just think the culture to some degree is different, and there's a willingness to sort of become more insular to protect those within that sort of regional bubble in a way that just wasn't flying in other provinces.
But unless there are sweeping constitutional changes which strip healthcare powers from the provinces, the power is in the hands of the premiers. In Calgary, Jonathan Muma, City News.